I'm going to check my patient's chart. All right, perfect. So my patient is Joanne Peterson. Date of birth 12/10/XX. She has no known drug allergies. She's high fall risk. She's full code. It looks like Joanne Peterson was recently admitted to our medical surgical unit for the diagnosis of hypertension. Her past medical history shows she had hypertension before, and asthma. Her medication list shows metoprolol, 50 milligrams by mouth daily, an albuterol inhaler, 2 puffs as needed for shortness of breath, and acetaminophen, 500 milligrams as needed for pain. And it looks like she lives at home. All right, perfect. Looks like I have all the information I need to carry out my assessment. So I'm gonna open the door, knock, open, close for privacy, open pain hygiene, and now talk to my patient. Hi there, my name's Amanda. I'm gonna be a nurse today under the supervision of CSS. Can I get a verification of both name and date of birth?
Joanne Peterson, 12/10/XX.
All right, perfect, Joanne Peterson. How have we been feeling today?
I'm feeling a little uneasy.
Okay. Well, you know what? We'll perform a set of vital signs just to make sure everything's okay, okay?
Okay.
Great. So I perform a set of vital signs. All right, it looks like, Joanne, I do see that you do have rather high blood pressure and heart rate. It shows signs of hypertension. Are you feeling any pain, like on a scale of 1 to 10, 10 being the worst right now?
I would give it like a 6.
Okay, so it's around the rather high side. Would you say there's certain things that maybe agitate this hypertension, like symptoms a little bit more than like other things, or is there anything that also maybe helps your symptoms a little bit pain-wise?
I would say just being in this environment, hospitals can stress me out sometimes, not being with my family, and helping would be the exact opposite, being with my family, being at home resting.
No, and that makes sense. Like the hospital is a rather stressful environment, so I totally get that. And would you say, how would you describe pain? Is it dull? Is it sharp? In between?
I would say it's just dull.
Okay, so a little something there, but it's enough to bother you.
Yeah.
Well, you know what? Let me just pull up your med card chart. Let me see. All right, perfect. It looks like on your medication chart, you do have a medicine that could help you with your hypertension. It's known as metoprolol. It's 50 milligrams by mouth, and again, the medication's for hypertension. It works by blocking the beta blocker receptors, which in return reduces overall blood pressure and heart rate. I will say some of the side effects are nausea, vomiting, headaches, dizziness. So those are just some of the side effects that are common in this medication. But do you think that's something that we want to try just to see if it helps at all?
Yes.
Right, perfect. Do you have any problems swallowing pills by chance?
No.
And do you have any known drug allergies?
No.
All right, perfect. Well, you know what? I'll go get that medication ready for you. In the meantime, you just sit back, you can relax. Your call light is by you by your bedside. Your railings are up, and your bed's in the lowest position. So, yeah, perfect. I'm going to go get the medication ready, okay?
Okay.
All right, perfect. I'm going to now perform hand hygiene before I leave the room. Open the door, and I'm going to close it for patient privacy. Now I'm in the med cart area, and I'm going to do my first medication check. So again, I'm going to check my patient. So the patient is Joanne Peterson. The medication is metoprolol. The dose is 50 milligrams, and the route is by mouth. The time is is 7 p.m. So perfect, about time to administer the medication, and the indications for hypertension. And again, I'll document my finding. I'll document after actually administering the medication at bedside. And then after that, I'm now gonna take out my medication and perform my second set of the medication check. So again, when I perform my second check, again, my patient is Joanne Peterson. The medication is metoprolol. Dosage is 50 milligrams. The route is by mouth, orally. The indication, again, is for hypertension. The time is 7, so again, perfect for the patient to take it at, and documentation will be done after administering. And again, when I take out my pill and medication, I'm checking for any wears and tears, and also if it's expired at all. And I also wash my hands beforehand before touching the medication. Perfect, there's no wear and tears. It isn't expired to 2044, so it's all good, ready for the patient. All right, perfect. I'll fill this up with some water so the patient can drink, so it helps her swallow the pill better. All right, perfect. Now I have my medication. I'm ready to go back in the patient's room. All right, knock, knock, knock. Open the door, close the door. Set medication aside. I'm going to perform hand hygiene quickly. Perfect. Now I'm going to talk to my patient. Hi there, my name's Amanda. Today I'll be your nurse. Can I get both verification, name, date of birth, please?
Joanne Peterson, 1210XX.
Alright, perfect, Joanne. So like I said before, I have your Metoprolol. And again, before I administer their medication, I'm going to go over the third rights of the patient. So again, my patient is Joanne Peterson. The medication that we're going to be administering is Metoprolol. The dosage is 50 milligrams. The route is by mouth. Time is 7:15. So perfect, we're ready to administer the medication. So time and the indication is for hypertension, which is perfect for Joanne Peterson. And again, so now I'm gonna perform my seventh one, which is documentation. So I'm gonna get it ready with the mark and now, Joanne, I'm just gonna scan your wristband to get you in the system, okay?
Okay.
Perfect. Then I scan this. Alright, perfect. I'm just gonna scan you one more time. Perfect. Alright, and looks like I'm having some troubles with my little buzzer, but in this situation, I would scan the medication too, and I would put it, oh, there we go. So after doing that, look on the dosage. Alrighty. Alright, Joanne, now I'm gonna, again, she's left it up to the position where she can swallow the pill and not choke on the water. So again, Joanne, I'm gonna first give you some water, okay?
Okay.
Perfect. And now I'm gonna give the pill. Perfect. And after this, I will dispose these in the right place. And then I'll give her some more water just to help her get the pill down a little easier. Did that go down okay?
Yes.
Okay, perfect. And again, now my right of like now I'm gonna do documentation to show that I administered the pill. My initials. Okay, perfect. It was administered. Alright, Joanne, so now that the pill's been administered, I'm going to give you 30 minutes to let the pill, kind of take its course a little bit and see if it helps at all for hypertension, and we'll set another form of vitals, okay?
Okay.
Alright, I'll be right back.
Sounds good.
And again, your collar's in your bed, and your railings are up, and your legs in the lowest position. Alright, I'll be right back. Hand hygiene. I open the door, I close the door for patient privacy. Right, 30 minutes has passed. Knock, knock, knock. Open the door, close door, hand hygiene. Hi there, my name's Amanda. Can I get a verification of both name and date of birth, please?
Joanne Peterson, 1210XX.
Okay, perfect, Joanne. I'm gonna perform now another set of vitals since it's been in 30 minutes, okay?
Okay.
Great, perform set of vitals. Okay, perfect. It shows me both blood pressure and also heart rate has reduced. How do you feel overall?
I feel a lot better.
Perfect. Is dull pain kind of going away now? Or?
Yes.
Perfect. All right. Well, it shows me the pill helped. Do you have any questions for me?
No.
Perfect. That's it. I'll just give you your call light just in case if you do need anything when I'm gone. Your hip railings are up. Your bed's in the lowest position. So perfect. I'm just gonna go now. Okay.
Okay.
All right. And then I put on hand hygiene, open door, and then close door for patient privacy.